It's season 4 of the Debunk fact-checking show, and on this episode we are going to be talking about issues concerning blood donation. And with this fact check, we want to be sure that everybody who is donating their blood knows the facts around blood donation. Please come with me and we will start with this fact check. Today, our experts are
Dr. Mwevas Raymond. I'm a physician at Insangia Hospital.
James Bernard Okello. I work in the capacity of a blood donor recruiter. I handle e-recruitment with the Nakasero Blood Bank.
Assumption 1 is I cannot donate blood while on medication. But can I?
For blood donors, of course, we want people who are healthy and not on any treatment.
So any person undertake medication is not allowed, is not advised to donate blood.
But there are some medications that probably one would say are not an absolute contraindication. So one has to look at the kind of medication you are taking and what your underlying condition is.
2. Is the blood donation exercise during and after so painful?
The insertion of the needle that takes blood off the donor may cause a bit of pain while it's being introduced. But other than that, it does not hurt. But you have to know that when you donate blood, they take off close to half a liter of blood. That's a beer bottle or a mineral water bottle of blood in terms of volume. And that can cause you a bit of lightheadedness shortly after the transfusion.
3 is from a tweet saying blood donation helps reduce one's chances of getting a heart attack. Is this true or false?
It's really proven scientifically that those who donate blood reduce risks of heart attacks.
For hypertensives, I think it's not advisable because you're already on antihypertensives, drugs that lower your blood pressure. But it also depends on how the severity or the grade of your hypertension. Well, if it is mild, it may not have that significant effect if you take off blood.
Next is having tattoos and body piercings leaves one out for blood donation. How true or false?
Depending on the depth of the tattoos and the piercing. These other camouflage tattoos and piercing one can donate. But if one has deeper piercing and tattoos, one is not advised to donate blood.
So that said, even if you donate blood and you have tattoos and piercings, your blood will be screened for these infections. But to reduce the risk of getting donors with high risk of infection, then that's why you shy away from people with tattoos and piercings.
Moving on, does traveling to a different region or country make one ineligible for blood donation?
Anywhere you move, you can donate blood, but having in mind that you must have spent over 3 months for male donors and 4 months for female donors.
How about the assumption that there's already enough blood donors and no need for more?
There can't be enough blood. We need blood mainly in emergencies, and we have never had enough blood. And because where transfusions are indicated, those are emergencies which are life-threatening.
How about the rumor that people engaging in same-sex relationships cannot be blood donors? True or false, Mr. Okello?
We have had campaigns to the same in the UK, especially among the homosexuals, pushing for rights to be permitted to donate blood. But on health reasons and scientific proven, it's not advisable for people of the same sex to donate blood.
When this blood is collected, it is used to save someone else's life. Could be accident and burn victims, heart surgery and organ transplant patients, pregnant and birth-giving mothers, or those battling with cancer. In fact, every 2 seconds, someone in Uganda needs blood. For more of these fact checks, subscribe to our YouTube channel at Media Challenge Initiative and listen to our audio fact checks on MCI Radio, which you can download on Google Play Store and App Store. Or you can follow these conversations on our Twitter page, that is The Debunk Show.